Hey everybody, it's Anita Foster with the Arlington Independent School District, joined by two very special guests today, Dr. Marcelo Cavazos, of course, our Superintendent of Schools here at the Arlington ISD, and we are very delighted to have the Director of Tarrant County Public Health Department with us, Vinny Taneja. Thank you so much. I can't even imagine your schedule right now, so thank you for taking time to talk to our parents and our staff and our students about COVID-19. Can you give us a summary update on where we are right now in our community?
Right. First of all, both of you, thank you for having me here this evening. And I want to thank our parents in our community because we're in this together. And I'll start with a summary of what is happening with COVID-19. As you know, this outbreak started sort of small in one little city in China and then just now has turned into a worldwide pandemic. And that happens time to time. When a new virus comes out, it just spreads like wildfire throughout the world because there is no natural immunity. We've never seen it as human beings before, and it just runs around the world. This happens. And now what we've seen is there are over close to 250,000 cases across the world in many, many countries. That's why it's a pandemic. It's on pretty much every continent, and almost every country has been reporting some cases. In the United States today, we have close to 16,000 cases because the disease is now spreading through the United States. And in Tarrant County alone, we have now 29 cases. But there's details in there. So we had one death in our Arlington community, and that was very severe, very stressful situation for a lot of us and our families here. But I want to reassure everybody that, this kind of stuff does happen. The individual, was elderly. By the nature, as we age, our immune system starts to go down. So it is expected that the elderly are going to have some severe health outcomes. So just to reassure everybody that these type of things do occur when large-scale outbreaks occur. And then we have positive news too. 2 people out of our 29 have actually recovered. So active cases in our community are back down to 26, even though the cumulative number was 29. So that's where we are today. But I also want to let everybody know that more cases are going to occur. So just be prepared. Don't be scared. Get educated on COVID-19.
And thank you for that, because as a public school district, I don't know that we've ever been faced with the challenge of closing schools for such an extended period of time. Dr. Cavazos, I'm going to turn that over to you. Have you seen anything like this in your time in education?
Yeah, so Anita, we've had school closures for weather and things like that. Never to this extent. So this is one of those times where we are in really uncharted territory, right? And so we are prepared. We've scaled up, but it is a different time for us. And I want to take just a moment to thank Dr. Taneja for being here today. I know you have been, your schedule is packed, but you've made time to be here for our families, our students, and our community, and I certainly appreciate that. But Anita, to your point, this is unprecedented time, and we have a task to have accurate information, which is why we are dealing straight with the source here, accurate information about what we can do during this time.
I know there's a lot of coordinated efforts going on with not just public health, with emergency management, local elected officials, superintendents like yourself. Dr. Taneja, talk a little bit about that coordinated effort and how public health is leaning on those other resources and assets to help flatten the curve, as they say.
Mm-hmm. Well, first of all, I want to echo a comment that Dr. Cavazos just made, that look to a credible source, right? In your local community, always look to your local health department to tell you the truth. Because what do we do normally? We get on social media, get on Facebook, and we read other people's opinion, what they think is going on. And a lot of times that's just hearsay, inaccurate. Some are jokingly putting stuff out there. Some are reading off the internet and just posting some material out there. And a lot of that is misinformation. So I really do appreciate the opportunity to come out here and actually tell you the facts. So look for credible sources like your local public health department or the CDC or state public health when there are disease-related issues. Now, a matter of coordination, right? We cannot do this alone. Nobody can do this alone because what you're fighting is a pandemic. And I try to simplify things, and a lot of people don't, like that. But the real situation that we're seeing is like you've got a hurricane that's coming to you, and as a community, we need to prepare and take shelter and take cover. So are we going to see cases? Yes. Like in a hurricane, are you going to see damage? Yes, it's going to happen in your community. But if we shelter and we really take cover, then we're going to be okay. And that's what all this coordination is about. We've been coordinating with the school entities, with our elected leadership in the county and the cities, with law enforcement, with first responder community, healthcare, daycares, churches. I mean, you name it. Everybody's involved in this effort to shelter our community from the impact of COVID-19. And that's why you're starting to see some of these community mitigation strategies come around. Because if it's one or two cases, public health can kind of lock it down right there. But when multiple cases are occurring across the country and the number is in the thousands, you have to really look at to a good level of sheltering for your community. How do you protect your community? And that's what community mitigation is all about.
You, Dr. Cavazos, have mentioned to our staff and to us, our teachers and everyone, that if we really want to flatten the curve, we've got to change our behavior. And so I'm so glad that we have the director here to help us know what do our students need to do who are going to be at home for an extended period of time with their parents. And it's going to be very tempting to want to get out and do the things that we normally do. What would you say to parents to help encourage them through what's going to be a fairly lengthy event?
Right. So let me first explain what flattening the curve actually means. So when we have any disease outbreak or an epidemic, what a scientist like to do is plot that information, how many cases occurred every day on a chart. And usually that shows you a spike occurring with the outbreak and then it subsides. And with large-scale pandemic, that spike can be significant, like you saw in China. There were like close to 100,000 cases in a small concentrated area, relatively for a big country. It was their city of Wuhan and Hubei province where most of this occurred. And as it spread across the globe, different things occurred, like Italy had a lot of cases, France had a lot of cases, now United States has a lot of cases, and most of them are concentrated in Washington State, California, and New York. But as a country, we're starting to see that spike occur, right? I mean, every day we're adding 2,000, 3,000, 4,000 cases. But for our community, we're still a fairly large community and we're fairly protected. We only have 29, and we have the time to implement these mitigation strategies. And the idea is we don't want to see a sudden spike. We want to see a slow rise, and we're realists. We're saying that the cases are going to occur, but we want it to be a slow rise and a gentle fall. And the reason is if you suddenly see a huge number spike up, your healthcare system gets overwhelmed, you don't get good healthcare, and then you get poor outcomes from there. But if you see a gentle rise, you can be taken care of by the healthcare system. And of course, you have less number of cases and less bad outcomes. And that's what the flattening of the epidemic curve does. And the behavior change. That is really, really important. As you can see, we're sitting almost 6 feet apart from each other, all of us, and there's a reason. It's a person-to-person disease. When I'm talking, there are droplets coming out of my mouth. If I happen to cough or sneeze, there's a 6-foot spray zone that I potentially could be infecting. So it's a droplet spread infection, just like the flu. And we want to make sure we change our behavior. We social distance from each other. We wash our hands throughout the day, with warm water and soap. And people ask me, why warm water? Well, it's like washing your whites. If you do it in warm water, you get better whites. And when you do your hand washing in warm water and soap, you get a better result. It's much cleaner. And throughout the day, because we are just humans, by nature, we touch our face, we scratch our head, we touch doorknobs and other surfaces. I've got my hands here on the counter, right? So we are just human, and we need to be washing our hands throughout the day because it's very, very hard to change some of these habits because they're just built in by nature. But we are learning not to touch our face so often, which is so hard to do, and then not to shake hands with each other. Our county official, our county judge came up with the corona wave, right? And that's a cool term, it's catchy, but he had science behind it, right? So coronavirus, why it's called coronavirus, if you look at it on an electron microscope, it has spikes, just like a crown, a king's crown. And it's the coronavirus. And he said, well, our hand has those spikes. Let's do the corona wave and not shake hands with each other, just wave at each other. What a good way to change behavior. That's right. So those are the type of things we're going to have to do. And the question comes, we're parents and we have kids, and kids are kids. They're going to be kids, right? What do you do? Well, first thing we've done with our leadership is, for now, we've closed schools because it's hard when everybody's together to prevent communicable diseases from spreading. Kids are in a classroom setting, They share materials. No matter how much you tell them, it's hard for us to change that behavior when they're together. So first thing is, let's stay at home. And then the question is, well, now we're home. What do we do? Do I go to the mall? Do I go to the movie theater? Do we go and play with friends, have them over for play dates? No, let's not try to do that. Let's reconnect with family as a unit. Mom and dad and kids and siblings, yes, you're okay in the house. Let's reconnect with each other. And if you really need to talk to a friend, FaceTime or use social media and connect with them. And don't be like disconnected from the world. We don't want that. Don't isolate yourself that much that you feel alone, but do it with technology. And that's a good behavior change. So can I go play in a park with my friends? Try close physical contact. Take a walk in the neighborhood, ride a bicycle, but try not to get too close with each other, because in a large group setting, especially if there's more than 10, 20, 30 kids gathering in a large park and trying to play a sport together, yeah, there's going to be contact. And we want to avoid that as much as we can. Again, with the understanding we're humans. We need some human contact, but avoid and social distance as much as you can. Sit down at home with your siblings, play a board game. Things that we've forgotten how important that is to do that. Get your parents involved. I tell my kids, get me involved. Of course, I'm busy right now, but get me involved, sit down with me and play that game, because this is the time to reconnect with families.
Very good. Dr. Cavazos, we have 60,000 students.
That's
They all have parents, and they're all home together. And we've rolled out some resources to really help them navigate through this time. Talk a little bit about the at-home learning hub and how parents can use that right now to the doctor's point, to work on activities together.
Right. So the Learning Hub that we rolled out has those activities and those things that we can engage with, that the students can engage with. First, we wanted to make sure that everyone was okay and how they're dealing with this crisis. So we had our teachers calling out to the students and the families as best as possible. Now we have the hub available so that students can begin engaging and continue that learning, but they can do that from home. And it's a little counterintuitive because we do have a lot of requests for people who want to volunteer. And the whole notion right now is to not have social interaction, and distance is important. And so we ask people to stay home. I do think that there will be at some point volunteer opportunities and things like that, well coordinated through the health department, the county, et cetera. But today we want students to continue to engage in their learning to some level. We also know that it's a stressful time in our community. And so that engagement is important. We also do a lot of communication, just like today, to make sure that everybody has the facts, everybody has the information they need, but also that they're informed to make good behavior decisions about what can and can't be done or shouldn't be done during this time.
And Dr. Taneja, what's the, or maybe your best guess, if you will, a timeline? Do we have one on how long public schools might be in the state that we're currently in?
Right. I mean, nobody's got a crystal ball. These things are very hard to predict, and how your community is going to actually go through the situation, because different communities have different preparation levels. In some communities, people are doing a lot more stricter criteria. Some are a little bit relaxed. So it's going to vary for each community. But generally, pandemics, when they spread, they're not a blip on the radar. They tend to rage on for a little bit longer. And the reason for that is the same why they became the pandemic in the first place, because we typically don't have natural immunity to these new viruses that come out. I mean, we've been through something similar in 2009 with the H1N1 flu pandemic coming out. The big difference there was it was still flu, and we had vaccine for the other flu, and then we were able to quickly manufacture a vaccine for the H1N1 flu. So we had help there. Coronaviruses, typically we didn't have anything because most of those are very mild. They cause a common cold, and this is a new one that's causing a serious illness. So there's vaccine development underway. There are pharmaceutical things being made, like medicine, to be able to fight this. And that's also part of the effort. We try to mitigate the impact to our community, kind of buy time, so that other tools come into play where we can actually fight off the disease. And one of the things I want to make sure people understand, it goes with behavior change and personal strategy on how to fight. Washing your hands is key, but also really changing the behavior. A lot of us still sneeze into our hands or cough into our hands, and that's a bad thing because you're going to have to wash all day long, and we're humans. Right after you sneeze, what do? you know, that's natural, right? Or you touch a doorknob because you got to go to the bathroom and wash your hands. So the best thing is sneeze in your sleeve, right? You know, cover your cough and sneezes with your sleeve because that way your hands are not dirty. And then, of course, stay home when you're sick. And that's very hard for a lot of us to do, especially adults, parents, because we want to go be the hero and go to work and tough it out because that's how we grew up. But it is very important that we stay home when we're sick so that we're not making others around us ill from our, coughing and sneezing. I might have a mild illness, go to work, and somebody's there that has diabetes or went through a transplant or some other issues that I might not even know. And that person becomes seriously ill and may die. So that's kind of a social responsibility too, to stay home when you're sick. And some of these behavior changes, we're just gonna have to do as a society, especially when we're facing a pandemic that's brand new.
Well, I know that you have a tremendous amount of work to do, so I want to leave with one question that I think a lot of people will ask, and I want to give you the opportunity to make sure we get people to the right place, and that's what should we do if we think that we've either been in contact with someone or if we think we might actually have COVID-19?
Right. So yes, that's a very important question because that's the most common question that we're being asked. I think I have been in contact with somebody that has COVID-19 or I have COVID-19. So first thing I want you to reassure is that if it's just a passing contact, don't worry about it. I don't think you're going to get anything. But if you've spent some significant amount of time with somebody who's obviously ill, has cough, fever, sneezing, flu-like symptoms, right? That is very likely that the person actually had flu because we're in the sort of the tail end of the flu season, but it's very widespread in our community still. And that's what's the most common respiratory illness right there in our community today. Is COVID-19 coming on? Yes. So it's gonna get a little confusing after that. But what we're hoping is flu goes away, and then COVID-19 is going to pretty much, come into our community. So right now is not the time to think you have COVID-19. But 2 weeks from now, things could look very different when we possibly have a lot more cases. So for now, I would still urge you to think flu first. But the symptoms are very similar. You start off with a dry cough, maybe a fever, and it can quickly, if it gets severe, it can develop shortness of breath. And that would be the time when I would say, yes, go to a doctor, get checked out. A lot of hospital systems like Baylor, Scott & White have brought on their online apps. And you can go and take a couple, 3 questions, and they walk you through the scenario. And at the end, they kind of give you an answer. Okay, you might want to get tested, or you're okay to stay home. And many other hospital systems are doing that. So get online and go through those questionnaires, and it will really help you feel better that you don't have COVID-19. And in general, for now, our community is starting to see cases, but we're not at widespread situation like we have been with the flu. So I just want to reassure everybody we're okay for now.
Okay, that is some good news.
Yeah, Anita, I would just echo, and I think this is a good opportunity to also discuss a little bit about how we make decisions to close school, because we know it has a big impact on families, and we don't take that lightly. But you're hearing Dr. Taneja, and this is the kind of guidance we get, practical, pragmatic, but also scientific as well, and we appreciate that from our health department and our county. Because this is the type of coordination that happens all day, different phone calls, different discussions, so that we make appropriate decisions. So this relationship will continue, and I appreciate Dr. Taneja for spending some time with us today to help inform not only our staff and our students, but really our entire community.
We really do appreciate that. We have linked from our landing page at AISD.net/coronavirus directly over to your resources. And I want to reiterate that point to everyone. Get accurate information. There's so much out there, but you're an official source, and we link to you in the CDC because we trust in those resources. And thank you for helping to guide our direction here. I know you both have a tremendous amount of work to do. Dr. Cavazos, Dr. Taneja, thank you so much. Again, you guys, go to our website, AISD.net. Right on the front page, you'll see the link to our coronavirus page. We have our resources that are there for the online learning hub, for where meals can be picked up, and other available helpful resources to help us all through. So until we see you again, stay healthy and keep social distancing.